Sandy Becker, and I work at the Trenton Medical Center, a primary care group.
I'm Rose West. I work at Meridian Behavioral Health Care, so we provide the behavioral services, mental health, and substance abuse. I think probably on both ends we see the same clients, and whether it's our clients, on the primary care side that have, chronic conditions, chronic medical conditions that they're not getting met, and that's sort of affecting their care on our end. So they're not able to focus on getting the treatment for their mental health or substance use needs, or on the primary care end, them not being able to follow whatever recommendations are being made by the physicians because their mental health conditions or their substance use conditions are, affecting that, sort of serves as a huge wake up for us that we need to be doing something so that, our clients are getting the care that they need to be able to manage their conditions on both ends.
In our community alone, and I'm sure others, it's a strong need, great need to have our patients treated not only physically but mentally. It just seems to go hand in hand. When you work on part of it, they're not treating the whole body. And we just felt like, we definitely needed to have some mental health, behavioral health in our community also.
It actually wasn't that difficult to get started. Their CEO actually serves on our board. So both of our CEOs, had been having these conversations for quite some time. So when National Council had presented this project to integrate care, was kind of a no-brainer that we wanted to take part. So we submitted our application for approval, and our intent was to do sort of a two-directional approach where we would be able to provide primary care services in the behavioral health side and behavioral health services on the primary care side. What we ended up doing was placing a mental health counselor in the primary care office in one of their clinic locations to provide behavioral health services to anyone that's referred by the physicians or the staff there that think that a patient is in need of that. Mm-hmm. For our end, we had to find a provider available to do it. We didn't already have a staff member available to just provide, the service in the primary care setting. So finding somebody that had a little bit of time, was our very first step. So initially we didn't even have a provider that was on site full time. The one that we found was only there 2 days a week for about 4 hours. I think it was on Tuesdays and Thursdays. And then the rest of her time was spent, over in our offices providing her traditional services of substance use and mental health services for our patients and on our side of it. And so that's how we were able to fund her position. But of course, as the need increased for her to be, on their site more, we had to sort of find other ways of funding her to be there. There wasn't a lot of funding available through this project, so we kind of had to get creative as far as how we would bill for the services that she provided there. Not all of them were reimbursable. She's able to, bill Medicaid, but if she's not getting patients referred to her that have Medicaid, we're still going to provide the service. We just have to find another way to bill for that. So that was probably the biggest undertaking in the beginning, is just structuring out time, finding a provider, and finding a way to bill for that.
Biggest challenge at first was space, trying to find a place to put someone to be able to have confidentiality with the patient. And we finally did find a space, for the person that was there just 2 days a week in the morning. And then down the road, we were able to actually open up one of our extra offices, and we ended up getting her a room where she went to us full time. I think one of my biggest challenges was getting the doctors on board with it, and it was constant emails letting them know, notification, going around and talking to them, and they have turned around tremendously. They are on board. They depend on our mental health person now quite a bit.
We don't focus as much on the primary care needs on our side of it. So trying to get them to make the referrals for, their patients to go over to for primary care services, was kind of an undertaking. Just trying to let them know that these things do go hand in hand, and if your client's needs physically aren't being attended to, they're not going to be able to come in for their sessions. They're not going to be able to focus on the treatment as you've set out. So when you're developing your treatment plan, you need to be making sure that you're attending to who you're referring to, and are you asking questions about if they have a primary care physician and when's the last time they seen their primary care physician and what medications they're on. I mean, questions that we just traditionally weren't asking on our end that needed to be asked. So that's something that we're continuing to have to do, especially as we're trying to expand more into bringing primary care over to the behavioral health side. So that's sort of an ongoing thing that we're doing. I think on the patient side of it, we're able to access patients that we didn't traditionally get to access because of the stigma that's sometimes associated with having a mental health issue. Even though we're not, located too far from the primary care office, some clients don't want to come down to our clinic because just being on the property kind of indicates to everybody what you're there for. And as Sandy mentioned before, it's kind of a one light town. So everybody kind of knows your business in this area. So having the ability to go into your primary care office and they don't know if you're there, because, you're getting your primary care needs met or you're there to see a counselor. But, it's sort of a one-stop. I can get any of my needs met and I still have the confidentiality of my privacy. And one of the things that, we're able to do is try to schedule the appointments that we make to provide the mental health services on the day that they have their primary care appointment. So if a patient is struggling with transportation issues, they don't have to worry about, getting to their primary care office and then going to a later appointment at their behavioral health care office. I can go, one place and get both needs met. Right. The outcomes have been good. It started off kind of slow, as Sandy mentioned earlier, because we had to get people on board. It's a new way of practicing. We had the mental health, clinician at their office, but she wasn't necessarily being utilized by the physicians because they don't really know how, to use her and what her purpose was. And so, it took her going to speak to them and letting them know what her purpose was and how she could be helpful to them initially. So we had to do some things, not just to announce our presence to the staff there, but to announce our presence to the patients. So we went through some process improvement sort of cycles and run-throughs to kind of increase the amount of patients that would utilize that service, sending out letters, generating, a note to the physicians, letting them know what the progress of the patients are that were coming to see us. And if there were any complications or problems, this is what happened. And perhaps you can follow up to encourage them to also be on board as well, so they saw that this was something that was not something separate from what they were doing, but it was actually a part of the work, part of the help, part of the gestalt of primary care and behavioral health being important to being attended to together. So now our clinician's indicating that she's received a lot more referrals and that her schedule is filling up, and we've recently sent her to another training to kind of learn new ways of restructuring how she does things, so that she's able to provide services the best way that she can, in a primary care office, because it is a different way of practicing on our end. But, it's all been very positive, and it's continuing to grow so much that we're trying to expand to other of their primary care offices as well, in addition to bringing them into our offices.